So today we're talking about addictions.
Yes.
Yeah, and we know particularly during the holiday season and this time of year, addictive behaviors can be more visible than usual.
Yes, absolutely.
And it puts a strain, or can put a terrible strain on our relationships with our friends, with our family members, with our significant others. Yeah.
When we're looking at addicts or persons who are struggling with addictive disorders, we have to understand that these people will require our support and understanding and patience. And while that is very difficult, because there's a lot of pain, there's a lot of heartbreak, seeing our family members and friends walking through the world like this, it is a huge challenge. It is a very difficult challenge for us to really step back and understand where's this person on their journey? What is the role of addiction in this person's life? This person is on a journey that we would not understand, and so it would require our compassion. So one thing that we need to do is, first, we need to understand that setting boundaries is important.
Yes.
Yeah. That also may be very difficult for us at home.
Especially during the holiday season, when we have family members over. Sometimes if you're dealing with somebody who is addicted to substances, there might be a lot of substances around as well.
Yes.
So how do we maintain our boundaries?
Sometimes it is as very simple as hiding the alcohol or not having it open in public for persons who you know are struggling, especially when we're more aware of it. And the other thing too is feeling comfortable to confront and feeling comfortable to do things for the safety of persons who you know are struggling with addictive disorders. And you know that they may be intoxicated and they're about to get behind the wheel, then you should feel safe enough and should feel comfortable enough to be able to say, no, this is not happening.
Yeah.
I know it's easier said than done at times, but this is a time when we should feel comfortable to do that.
And negotiating that with some safety, some concern for your safety and for other person's safety. What I find interesting about this conversation too is that you're encouraging us to have compassion.
Yes.
To understand that when we're dealing with someone struggling with addiction, there's the behavior that we're seeing, but there are other components of that.
Yes.
And we often talk about a biopsychosocial understanding of addiction.
Absolutely.
So biology, understanding there's something that's going on with this person's brain and how this body is relating to the substances. So something as simple as don't do it is not going to suffice. Yeah, because there's some mechanisms that's going on there. Psychological in terms of how this person thinks about the substance, and then social, the interactions that happen. So you just highlighted one. You're out with your friends and you need to say, hey, you are not driving. Yeah, and so being able to have the strength to do that could sometimes be a significant struggle.
Yes, absolutely.
Any closing words as we're going to end this segment?
Always just reconsider how we look at people and really try to avoid the temptation to judge. Yeah. Especially during this time.
So if you know someone who is struggling with an addictive disorder, and again, we spoke mainly about alcohol here, but people could be addicted to sex, could be addicted to gambling, certain relationships that are unhealthy for them. So if you know someone who's struggling with addiction, this might also be a great opportunity to open a conversation. Yes. To say, you know what, I think that there's a lot going on here and you might need to get some help.
Absolutely.
Yeah. Thank you so much for joining us, Karline.
Of course, no, thank you.
And thank you for joining us in this video. Yeah. Take care and happy holidays.